These days, it feels like you can access, well, pretty much anything online, right? And
Mhm.
that includes medical tests and just tons of health information. It's so easy to just hop online, book a test for whatever symptom is bothering you, or even buy a home kit.
Absolutely. And that ease of access, it's kind of a double-edged sword.
Right.
It comes with this big temptation
Mm.
to maybe skip the doctor, try to figure it out yourself.
Self-diagnose.
Yeah, self-diagnose and jump straight to testing based on, your best guess or what Dr. Google says. It feels like a shortcut, doesn't it? A fast track to understanding what's going on.
But as we were digging into the sources you shared, it became really clear that maybe this shortcut isn't always the quickest or the safest path.
Not at all.
So that's our mission today, to take a deep dive into this material, sort of unpack the potential pitfalls of bypassing professional medical guidance when it comes to testing, and understand the right way to approach it based on what's in these sources. Okay, let's unpack this then. Looking at these sources, one of the most striking insights is just how risky it can be to take a test without getting professional advice first. It seems simple, you get a number, you look it up, but the sources make it clear that's kind of where the danger begins.
It really does. Um, the first and probably the biggest risk highlighted is just misinterpreting the results.
Right.
Medical tests, they're really designed to be interpreted within a specific clinical context. Without the training and knowledge a doctor has, understanding what those numbers truly mean is incredibly difficult.
So a high value or a low value doesn't automatically mean you're sick. That feels a bit counterintuitive.
It is, and that's a key takeaway from the sources here. High or low values in a test don't always signal a problem. Normal values themselves aren't like set in stone. They vary quite a bit depending on your age, your sex, the specific laboratory that ran the test, their unique reference range,
Hmm.
and crucially, your own individual health history and baseline.
Can you give us a concrete example from the material, something that really brings that to life?
Sure. Um, think about blood sugar. A high reading doesn't automatically mean diabetes. Not always.
Oh.
Yeah, it could be temporarily elevated because of stress or something you just ate,
Oh.
or maybe you're just dehydrated.
Huh.
Or take cholesterol, a slightly high number in someone young, healthy, fit.
Hmm.
Well, that might be less concerning than the exact same number in someone older with, say, multiple risk factors.
Right.
But if you just saw that number without context, you might freak out, self-diagnose, and maybe even push for treatments like statins based on, well, incomplete information.
Wow, that makes sense. It's really not just the number, it's the whole picture around the number.
Precisely. And this leads directly into another major pitfall the sources talk about: unnecessary anxiety, or maybe even worse, dangerous false reassurance.
Oh.
If you're trying to interpret results yourself, especially with, Dr. Google as your co-pilot,
Uh-uh.
you're almost guaranteed to stumble upon the most alarming potential diagnoses, which leads to, huge stress and panic over something that might be totally minor or benign.
And the flip side is just as bad, I guess. You get a normal result and just stop worrying.
Exactly. A result that falls within the normal range might give you this false sense of comfort.
Right.
It can make you ignore underlying issues or maybe subtle symptoms you've been having or other big risk factors like a strong family history of something or lifestyle choices just because the number looked okay on paper.
Hmm.
The sources specifically mention how even minor variations in common tests, like, say, vitamin D or thyroid levels, TSH, ESR, these are actually quite common and often clinically insignificant. But they can cause immense panic when someone tries to interpret them without that clinical training.
Yeah.
There's a quote in there that really stuck with me: "Never let a number comfort or frighten you unless a doctor has interpreted it."
That's a really powerful way to put it. Data isn't the diagnosis.
It absolutely isn't.
Hmm.
And, well, what happens when you're just guessing what the problem might be?
You take the wrong tests.
You often take the wrong tests,
Yeah.
which is, a complete waste of money and, more importantly, precious time.
Like testing for every possible cause of a headache, maybe.
Exactly. Or the example given in the sources.
Mm-hmm.
You got a fever, you suspect dengue, so you test for that.
Okay.
But maybe the real problem is actually urinary tract infection or typhoid fever, something completely different, needing totally different treatment.
And you've delayed finding that out.
Right. The money you spent on those random tests could have gone to the correct diagnosis and care from the start. And delaying that correct diagnosis, that can have serious consequences.
And just focusing on one test or one symptom, you risk getting an incomplete picture, I suppose.
Absolutely. Tests taken without guidance, they tend to look at things in isolation, isolated factors. They don't account for like broader health trends or how different systems in your body are interacting or how results might connect to other conditions you already have.
So like the vitamin D example.
Yeah, perfect example. A home test shows low vitamin D. Okay, fine. But it doesn't tell you why. Is it just your diet? Or could it be a sign of something more serious, like a malabsorption issue?
Ah, okay.
So by self-diagnosing something relatively minor, you could tragically overlook something far more serious, even life-threatening, that a doctor looking at the whole picture would have considered.
Plus, isn't there the issue of like when you take the test and how you
Yeah.
prepare?
Yes. Another key point from the sources. Many medical tests, they need specific timing, like first thing in the morning versus evening,
Right.
or specific preparation fasting, avoiding certain medications or even activities beforehand.
And without guidance.
Without that guidance, you might take the test under the wrong conditions, which means the results could be completely incorrect or just invalid.
Like the blood sugar test example.
The classic example, taking a blood glucose test right after you ate when you were supposed to fast. The result will be way off, totally misleading,
Yeah.
and could lead to unnecessary worry or even wrong medical advice if someone acts on it without a doctor reviewing everything.
Wow. It sounds like it can be a real psychological minefield, too.
Oh, without a doubt. The sources definitely touch on the anxiety, the stress, even panic that comes from trying to diagnose yourself,
Especially online.
especially when you're relying on potentially inaccurate or just fear-mongering information from online searches or, social media forums. You're just swimming in information without the filter of actual medical expertise.
And I guess there's also the risk of confirmation bias. You sort of see what you expect or fear you'll see.
That's exactly right. You might interpret symptoms or even test results to confirm a suspicion you already have. You lack that objective perspective a professional brings. And all these factors, kind of paradoxically, can lead to overutilization of healthcare down the line,
Yeah.
maybe prompting unnecessary doctor visits or demanding medications based on, well, flawed self-interpretations.
Okay, so we've covered a lot of the significant risks. This is where it gets really interesting, though. Are there any situations, according to these sources, where you might get a test without talking to a doctor first?
Well, the sources do identify a few specific scenarios where getting test results before a doctor's consult might happen. But, and this is important, they come with a really critical caveat.
Okay. What kind of scenarios are we talking about?
Things like those standardized annual health checkup packages that some employers or labs offer.
Right, I've seen those.
Or, importantly, doctor-recommended monitoring for conditions you already know you have.
Ah, okay. Like managing diabetes.
Exactly. Like routinely checking blood sugar if you have diabetes, or blood pressure for hypertension, or thyroid levels if you have a known thyroid disorder. Things your doctor has already told you to track. Another one is confirming a widely known issue with a generally reliable home test, like a pregnancy test, or maybe a COVID antigen test if you have clear symptoms.
Makes sense.
And sometimes, lab reports are just needed for administrative stuff, like insurance applications or something.
Okay, so in these specific cases, non-urgent, routine checks, monitoring stuff, you might get the results first.
Exactly. But the absolute non-negotiable point that's emphasized over and over in the sources
Yeah.
is that even in these scenarios, you must always take the results back to a healthcare provider. Always.
You'll need the doctor.
You still need the doctor. They need to interpret those numbers in the context of your overall health, your history, any symptoms you might have,
Yeah.
the specific situation, everything. The test result itself isn't the end of the story. It's just data points for the doctor to weave into the bigger picture.
Okay. So what does all this mean for someone listening? How should you approach medical testing based on everything we've learned from these sources?
Well, the recommended approach outlined is actually pretty clear, and it's designed to help you avoid all these pitfalls we've been talking about.
Step one sounds like it has to be talk to a doctor.
It absolutely is. That's the crucial first step. Consult a doctor, share your symptoms, your concerns, your health history. Let them use their expertise to figure out if tests are even necessary. And if they are, which ones are actually appropriate for your specific situation.
And they'll give you the necessary paperwork like a prescription.
Yes. Get that prescription or a referral. This makes sure you're getting the correct tests, and it can also be really important for insurance coverage later on.
Then you go get the test done.
Right, at a trusted, reputable lab. And while you're there, or when you book it, always ask the lab staff about any prep needed, fasting, stopping certain meds, whatever it is, just to make sure the results are valid.
And after you get the results back from the lab, don't just look at them yourself.
No. This is the key part, the linchpin. Go back to your doctor with the results. Let them interpret what those numbers mean in the full context, your history, their examination, any symptoms you have. This is where the numbers actually gain meaning.
And resist that powerful urge to hop online and start spiraling.
Please resist. Avoid the online interpretation rabbit hole. Trust your doctor's explanation and their guidance. And, the sources do mention teleconsultation is a really convenient option now.
Oh, yeah.
Yeah, for both planning tests initially and then for reviewing the results with your doctor afterwards. It makes it easier to follow these steps.
That whole process just seems so much safer and, frankly, more effective in the long run.
It absolutely is.
Yeah.
So just to quickly recap the biggest dangers we discussed based on the sources. You risk seriously misinterpreting the numbers.
Leading to anxiety or false reassurance.
Exactly.
Yeah.
Crippling anxiety or dangerous false comfort. You could waste money and time testing for the wrong things entirely.
Delaying treatment for the real problem.
Delaying treatment? Yes. You risk missing a critical diagnosis altogether, or only getting a partial misleading view of your health because a test was taken out of context or done improperly.
And the solution isn't to be afraid of testing itself, but just to make sure it's guided properly.
Precisely. Always involve a healthcare provider. They provide that essential context, the personalized guidance, the comprehensive assessment that really no amount of independent testing or online searching can ever replace.
This deep dive really underscores that medical tests are powerful tools, aren't they? But like any tool, they need skill and training to use correctly and safely.
Yeah, that quote really sums it up perfectly. A test is a tool, not a diagnosis.
Yeah.
And you're not supposed to use tools without training.
Tests are there to inform and support doctors, help them make decisions about your health. They're not meant to replace that crucial professional judgment.
Absolutely. Your health is simply too important for guesswork. As the sources strongly advise, your health is too important for guesswork. Get tested right with the right guidance.
So here's something to think about. If bypassing professional advice and self-diagnosing with tests is essentially a gamble with your health, well, beyond the money you might spend on the test itself, what are the real costs you could be risking? Think about the potential price in terms of your long-term health, your peace of mind, or maybe just the critical time lost in getting the care you actually need.